Good morning, everyone. So today we will be discussing about the two arterial disorders, the arteriosclerosis and the atherosclerosis. Since we will be discussing more on arteries, let's have a brief review first on the anatomy of the blood vessels.
We previously learned that blood is carried to your cells through transportation tubes called blood vessels, and your heart is the pumping station that propels that blood. Now, every time your heart beats, blood is pumped into large arteries to start the one-way journey around your body. From the large arteries, blood moves into smaller arteries called arterioles, and then into the capillary beds. And it's in these capillary beds where you have the exchange of gases and nutrients. Your blood is then drained out of the capillary beds and ready for its return trip to the heart by first going into small veins called venules and then merging into larger veins, which eventually flow back into the heart. Now, like a busy highway, your blood vessels have to be well constructed to withstand all the pressure that comes with circulating your blood every minute of every day. To help stand up to the high demand, the walls of the blood vessels are constructed of 3 layers known as tunics. The tunica intima is the innermost layer of the arteries and veins. And you can easily recall this term by remembering that intima and innermost both start with the letters IN. Now, the tunica intima is composed of a thin layer of endothelial cells and lines the entire circulatory system, from your heart and the large arteries all the way down to the very tiny capillary beds. And as we previously learned, capillaries are comprised of only one layer of endothelial cells, and therefore capillaries only have a tunica intima. Now, this ultra-thin design is what allows for nutrients and gases to be exchanged in the capillary beds, and it's a unique feature of capillaries. The walls of arteries and veins have 2 additional layers, or tunics, forming too big of a barrier for there to be an exchange of gases and nutrients. So why don't we go ahead and take a look at those 2 additional layers found within the walls of your arteries and veins. Now, working our way from the inside of the vessel out, we see the next layer called the tunica media. This is the muscular middle layer of the arteries and veins. And you can easily recall this by remembering that media and middle and muscular all start with the same letter, which is M. The tunica media of arteries contains more smooth muscle than the tunica media of their counterpart, the veins. And this allows the arteries to constrict and dilate to adjust the volume of blood needed by the tissues that they feed. When the smooth muscle found within the tunica media is stimulated, it contracts, squeezing the walls of the artery and narrowing the vessel. The term vasoconstriction is used to describe the narrowing of the blood vessel due to contraction of the muscular wall. When an artery constricts, the flow of blood decreases and the pressure within the vessel rises. So vasoconstriction is a mechanism your body uses to regulate important functions in the body, such as body temperature and blood pressure. Vasodilation is the opposite of vasoconstriction and is a term used to describe the widening of the blood vessel due to the relaxation of the muscular wall. So when a blood vessel dilates, blood is able to flow through the vessel with less resistance. Therefore, vasodilation has the opposite effect of vasoconstriction on such functions as body temperature and blood pressure. Now, the tunica media of arterioles contains a large amount of smooth muscle, and therefore arterioles are key regulators of blood flow between the arteries and the delicate capillaries. And this regulation allows for a more efficient exchange of gases and nutrients when blood is within the capillary beds. The tunica adventitia is the outermost layer of the arteries and veins. The word adventitia in tunica adventitia comes from the Latin adventitius, which means coming from outside. This strong outer layer is composed of connective tissue that allows the blood vessel to withstand forces acting on the vessel wall. It also contains strong collagen fibers that help anchor the blood vessel to surrounding tissues, and this gives the vessel some stability. Let's review. All arteries and veins contain 3 layers. The innermost layer is called the tunica intima. The muscular middle layer is called the tunica media. and the outermost layer is called the tunica adventitia. Because capillaries are only one cell layer thick, they only have a tunica intima. This ultra-thin design allows for the exchange of gases and nutrients through the capillary walls. The smooth muscle found in the tunica media can be stimulated to contract, and this results in vasoconstriction and the narrowing of the blood vessel. When the stimulation stops, the smooth muscle relaxes, resulting in vasodilation and the widening of the blood vessel. The ability to contract and dilate helps to control the amount of blood flowing through the vessel.
Arteriosclerosis, from the word itself, arterio, which means arteries, and sclerosis, meaning hardening of the tissue. So when we say arteriosclerosis, it is the hardening of the arteries, or it is a diffuse process whereby the muscle fibers and the endothelial lining of the walls of small arteries and arterioles become thickened. And when we say atherosclerosis, it is the accumulation of lipids, calcium, blood components, carbohydrates, and fibrous tissue on the intima layer of the artery. And these accumulations are referred to as atheromas or plaques. And atherosclerosis is the most common form of arteriosclerosis. Atherosclerosis is not a single disease entity, but rather a pathologic process that can affect vascular systems throughout the body, resulting in ischemic syndromes that can vary widely in their severity and clinical manifestations. And atherosclerosis is the leading cause of coronary artery and cerebrovascular disease. Atherosclerosis can develop at any point in the body, but certain sites are more vulnerable, such as regions where arteries bifurcate or branch into smaller vessels, like your coronary artery, your carotid artery, your peripheral arteries, and even your renal arteries. For the epidemiology, despite advances in medical, interventional, and surgical treatment, atherosclerotic diseases remains the most important cause of death in developed and underprivileged nations. And in the United States alone, coronary artery causes approximately 1 of every 6 deaths, accounting for more than 400,000 deaths annually. And here in the Philippines, according to DOH, the top 1 and top 2 leading cause of death is coronary artery diseases. The prevalence and severity of atherosclerosis among individuals and groups are related to several risk factors. Many risk factors are associated with atherosclerosis. So for the non-modifiable, the increasing age, and then male gender, because they have more below the knee pathology than the female's lower extremities. But contrary to this previous opinion, this study also found that the female gender is an independent risk factor for the peripheral arterial disease, family history, and even the genetic abnormalities. Other risk factors that are modifiable includes hyperlipidemia, or there is a high level of lipids or fats inside the blood, and then hypertension, then cigarette smoking, since there is an evidence that smoking decreases the high density lipoprotein, or the HDL, or your good cholesterol in the body. And nicotine in tobacco decreases blood flow to the extremities and increases heart rate and blood pressure by stimulating your sympathetic nervous system, causing vasoconstriction. Then, diabetes, which speeds the atherosclerotic process by thickening the basement membranes of both large and small vessels. And then the C-reactive protein, or the CRP, which it is a sensitive marker of cardiovascular inflammation, both systematically and locally. Slight increase in serum CRP levels are associated with an increased risk of damage in the vasculature, especially if these increases are accompanied by these non-modifiable risk factors. Additional risk factors includes inflammation in the body, and when there is hyperhomocystinemia, which positively correlated with the risk of peripheral, cerebrovascular, and coronary artery disease, as well as venous thromboembolism. The homocysteine is a protein that promotes coagulation by increasing factor V and factor VI activity while depressing protein C activation and increasing the binding lipoprotein in fibrin. Another risk factor is the metabolic syndrome and the lipoprotein, especially if there is a high level of LDL or the low density lipoprotein in the blood. Next is factors affecting homeostasis, and if there is a stressful lifestyle and obesity. Most symptoms of atherosclerosis do not show until a blockage occurs. The clinical signs and symptoms resulting from atherosclerosis depends on the organ or tissue affected. If the coronary artery is affected, the patient will complain angina or chest pain. There is a shortness of breath and fatigue, confusion if the blockage affects the circulation to the brain, and there is a pain in the leg, arm, and anywhere else that an artery is blocked, or muscle weakness in the legs from lack of circulation. For the pathophysiology of atherosclerosis, kindly watch this short clip.
So we know that atherosclerosis is the main contributor to coronary artery disease, and in the coronary arteries, atherosclerosis will cause buildup of these fatty cholesterol-filled plaques. Like so, you can see me drawing them in here, and they're occurring all over the coronary arteries. So what they do is they sort of obstruct blood flow down the length of the coronary arteries and through all the branches of the coronary arteries, because they're just these big bulges of fat that are in the way. So how do they develop? What exactly is this process of atherosclerosis? Well, let me show you what this looks like in a snapshot before we actually look at the mechanisms. So I'll take this piece of coronary artery here, let's say this piece right there, and we'll blow that up. So if we look at that, and when it's nice and healthy, right, it's going to look like this. So here's our healthy blood vessel, nothing built up inside, and so you can see blood is going to flow through this way, right? And this here is a cross section of the artery. So, as far as we can tell, blood can flow smoothly and nicely through this blood vessel, no obstruction, everything looks good. But when you start getting atherosclerosis happening, things can get a little bit different. So when you start getting atherosclerosis happening, your coronary artery might start to look something like this. And so immediately, we can see that there's a pretty big difference between the first vessel here, the nice clean one, and the second vessel here, the atherosclerotic sort of fatty plaque vessel here. All this yellow stuff is some gross fatty plaque that's been deposited into the vessel wall. And if we look at the cross section here, we can see that it's really doing a number on the amount of blood that's able to flow through this vessel, right? And so if we're blood here in red, we can't actually get through this vessel quite as much as we could through here. Look how much room we had in this one. And so this is why, because of all this buildup, this is why we're going to get downstream symptoms. How exactly does this happen? Well, let's redraw our own arteries so we can go through it step by step. So here's our blood vessel there, and now I'm drawing the 3 layers of the wall of the blood vessels. And on the very inside of the blood vessel, as part of this pink layer here, we have a single layer of cells called the endothelium. So let me just draw out the endothelium here. And although it's just a single layer of cells thick, the endothelium has a lot of really important roles. One of its really important jobs is to act as a barrier. And it acts as a barrier between stuff that's in the blood and the rest of the blood vessel wall. So stuff can't just pass through and get into the rest of the blood vessel wall. And this barrier function will become pretty relevant in a minute. You'll just have to take my word for it for now. And another really important job that the endothelium has is to secrete proteins onto its surface that prevent clotting, that keeps blood flowing nice and smoothly. So those are two of its major jobs. It has a couple more, but those are the ones that are relevant in atherosclerosis. Alright, so you remember that big fatty vessel from before. Well, how do we get from this, our nice clean blood vessel, how do we get from this to that? Well, let's take a look. Well, the first thing that has to happen is that there has to be some irritant present. Something in the blood that's going to predispose this atherosclerosis to happen. So what are some irritants? Well, things like too many lipids, so specifically fats and cholesterol, LDL cholesterol, the bad cholesterol. And let's actually put some of this cholesterol in the blood vessel so we can just see it really clearly. And I'll just label it LDL, LDLC actually, so you know this is cholesterol, LDLC. Another irritant, probably the worst one, is toxins from cigarette smoking. So we'll put some toxins in the blood from cigarette smoking. We'll do them in gray here. And another major one is just hypertension, high blood pressure. So we'll try to show that pathologically high blood pressure here by these arrows. High blood pressure. And this means high blood pressure. And I'll actually write hypertension here because I just want to make it clear that it's the chronic exposure to high blood pressure. It's not just, high blood pressure every once in a while. So that's our first step, to have an irritant present. And our second step is to actually have damage to the endothelium by the irritant. And so our barrier now is broken down. It started to break down. So that's step 2. That's actual damage of the endothelium. And in step 3, regardless of whatever damaged the endothelium, I mean, if it was toxins or if it was the cholesterol or if it was the high blood pressure, regardless of what actually damaged the endothelium, what happens next is that the cholesterol will jump in there and start to collect under the damaged endothelium. So let me actually clear away some of this because we're going to focus on the cholesterol now. So this is cholesterol and it's going to sort of settle in here. It's going to think to itself, hey, that looks pretty comfy. That looks like a cozy place to be. So I'm going to just jump in there. And of course, these are coming from inside the blood, right? They're not just sort of multiplying. They're floating around in the blood. And then when they come across this damaged endothelium, they're going to join their friends. And when they build up to this sort of flattened extent here, they're known as a fatty streak. So one thing that happens to the cholesterol when they get inside the wall of the blood vessel there is that they start to get oxidized. They sort of change a little bit. And when they change, when they get oxidized, that sends a signal to the immune system, to our body's immune system. And that signal will bring around these cells of the immune system called monocytes. So they'll sort of show up almost like police. So here's a monocyte here, and I'll draw it in white to remind you that it's a white blood cell. And this monocyte doesn't really like that the cholesterol is starting to collect in the blood vessel walls. So the monocyte will actually chase in after the cholesterol to try to break up the little party that they're having. And so I'll actually draw what happens next down in this next bit of the blood vessel down here, just so we can keep in mind all of the past events. So you may have noticed that I drew this white blood cell to look like a Pac-Man sort of thing, eating up this cholesterol, because that's essentially what it does. Once it gets into the endothelium, it converts into something called a macrophage. Macro meaning big, and phage meaning to eat. So it's really this big eater its job here is to devour that LDL cholesterol that's collected in the endothelium. Unfortunately, things don't go as planned for our macrophage because what ends up happening is it starts to gorge itself. The macrophage eats so much cholesterol that it just sort of becomes too full of these yellow cholesterol drops and it sort of dies off. But it's full of cholesterol, and someone a long time ago looked down a microscope and thought that these dead macrophages filled with cholesterol looked like foam, like sea foam that you see at the beach. So these dead macrophages filled with cholesterol are now called foam cells. So let's catch our list up. And remember, these foam cells were actually white blood cells. So when they die, they release these signals that sort of call in reinforcements. And I'm going to use that to remind you that atherosclerosis is primarily an inflammatory disease. It's an inflammatory condition. And so when these foam cells release their cytokines, their signals, they call in reinforcements, and the whole process sort of proceeds in this vicious cycle, as you'll see. And don't forget that LDL is also still being deposited into the wall from the bloodstream. And as part of this inflammation, more and more endothelial cells get damaged. So I'll move our drawing down even further so we can look at the next sort of development. And so you can see this mountain of cholesterol and foam cells, dead macrophages that are filled with cholesterol. You can see this mountain just keep on building and bulging out into the middle of the blood vessel. And so by now things are just way out of control, right? And these guys in here, this is the smooth muscle part of the artery, by the way. So this is the smooth muscle layer. These guys start to take notice, these smooth muscle cells. So what ends up happening is that you get smooth muscle cells that sort of migrate out of the smooth muscle layer, and they sort of migrate. I hope you can see this. I'll draw them a bit thicker. They start to migrate out of the smooth muscle layer and into the fatty plaque here, right? Because they can sort of sense that something's just not quite right. And what they start to do is they really want the plaque covered up, because they don't want the thrombogenic, remember thrombogenic means clot forming, they don't want the thrombogenic plaque to be exposed to the blood. So what they start to do is they start to secrete a fibrous cap. They sort of spit out this collagen and elastin protein cap that covers up, right? So I'm drawing it in purple, that covers up this plaque and shields it from the bloodstream. And that's called a fibrous cap. And they also do something else. The smooth muscle also do something else. So you remember these foam cells that died in here? Well, when they release their signals after they die, they induce the smooth muscle into depositing calcium into the plaque. So I'll draw that in. I'll draw in these little calcium crystals now. So you can see it's just starting to look like a mess in here. There's just all sorts of stuff going on. So again, this is really not something you want to have happening in your body. And so just by looking at this, what can we say is happening to the blood vessel? Well, I mean, we can see this huge bulge. We can see that the plaque is obviously bulging into the blood vessel, and it's probably going to restrict the flow of blood that can get through here. So that's one thing that atherosclerosis is doing. It's occluding, it's blocking off the arteries. The second thing is, well, look at this calcium. I mean, if there's one thing we know about calcium, is that it's really tough, it's really hard. And so this by the smooth muscle laying down calcium, that's one of the ways that atherosclerosis makes your arteries really hard. And that's actually part of the name. Atherosclerosis actually means hardening of your arteries. But I think in terms of coronary artery disease, the biggest reason that atherosclerosis is bad is because it can cause complete blockage of the artery. And that blockage of the artery can happen because sometimes this plaque, this fatty plaque, it can rupture. And when it ruptures, all this thrombogenic plaque material gets exposed to the blood. And when it gets exposed to the blood, it starts to form this really big blood clot in the middle of your artery, in the middle of one of your coronary arteries. So let's just draw that in here. Let's just draw this big blood clot. Pretend that this has been ruptured and this yellow thrombogenic material has been exposed, and this big blood clot's going to form. By the way, I'm originally from Jamaica, and blood clot is a bad word in Jamaica, so I apologize to any of my Jamaicans who are watching this. So this big clot could form, and it could totally block off the blood vessel. And when that happens, no blood can get through, right? So this is really the biggest reason that we don't want atherosclerosis to be happening in our coronary arteries, because you can see that we've blocked off the blood flow, and if blood isn't allowed to get past this clot and get to the piece of the heart that it's supposed to be serving within about 20 minutes, then you get irreversible damage and death of that piece of heart muscle. So for example, what we drew was this little piece of artery here, right, in blue. So if a atherosclerotic plaque and a clot developed right there, as it has in our vessel here, then that would be really, really, really bad, because, you know, all the blood for this whole part of the heart is coming from this upstream vessel. So without getting blood flow through this vessel for about 20 minutes, if this clot sort of persists for about 20 minutes, all of this heart muscle would start to die off. So that would be a massive heart attack. And actually, let me just clarify. So we say heart attack, but in medicine, we refer to a heart attack as a myocardial infarct, or an MI. So myocardial just refers to heart muscle, cardia for heart, and myo for muscle. So heart muscle. An infarct means death of tissue due to lack of oxygen from lack of blood. So a myocardial infarct is death of heart muscle due to lack of oxygen. So here we've had a myocardial infarct due to this big plaque that developed here.
The complications of atherosclerosis depend on the location of the blocked arteries. For example, if it's in coronary artery disease, this may cause myocardial infarction or the heart attack. If it's in carotid artery disease, this may cause transient ischemic attack or TIA or stroke. If it's in peripheral arteries, this may cause the PAD or the peripheral arterial disease. Another complication is the aneurysms or a bulge in a wall of your artery. And if this aneurysm bursts, you may face a life-threatening internal bleeding. Doctors may find signs of narrowed or enlarged or hardened arteries during physical examination. This includes a weak or absent pulse below the narrowed area of the artery. There is a decreased blood pressure in the affected limb, whooshing sound or the bruit around the arteries heard with a stethoscope. Signs of a pulsating bulge or aneurysm in the abdomen or behind the knee, and evidence of poor wound healing in the area where blood flow is restricted. Depending on the results of the physical examination, the doctors may suggest one or more diagnostic tests includes blood tests, the Doppler ultrasound, ankle brachial index, other imaging tests like angiogram and ECG. The management of atherosclerosis involves modification of risk factors, a controlled exercise program to improve circulation and its functioning capacity, medication therapy, and interventional or surgical graft procedures. Various drugs can slow or sometimes even reverse the effects of atherosclerosis, like cholesterol medications such as statins and fibrates to lower the LDL and boost the HDL or the high-density lipoprotein. The antiplatelet medications such as aspirin to reduce the likelihood of clumping of platelets, and then anticoagulants like heparin, warfarin to thin the blood to prevent clots from forming, and blood pressure medications such as beta blockers, the ACE inhibitors, and calcium channel blockers. Doctors may also suggest certain medications to control specific risk factors such as diabetes, so the doctors may prescribe OHA or insulin to decrease the blood sugar of the patient. Sometimes medication to treat symptoms of the disease such as leg pain during exercise are prescribed, and sometimes more aggressive treatment is needed if the patient have severe symptoms or a blockage that threatens muscle or skin tissue survival. The patients may be a candidate for one of the following surgical procedures like angioplasty, endarterectomy, thrombolytic therapy, and bypass surgery.
Coronary angioplasty, also called as the percutaneous transluminal or balloon angioplasty, is a treatment procedure to restore the blood flow in the narrowed or blocked coronary arteries caused due to plaques or blood clots. Most coronary angioplasty procedures last between 30 minutes to 3 hours. Once the patient is admitted, his heart is monitored and is given an intravenous sedative to relax the body. A needle is inserted through the wrist into the radial artery. A guard wire is then passed through the needle and is guided through the arterial system up to the heart. A flexible catheter is slipped over the wire and threaded up to the heart. This is monitored using a continuous X-ray imaging device called fluoroscope. At this point, the guard wire is removed and the tip of catheter is positioned to enter the coronary artery. A special dye is injected which allows the fluoroscope to take X-ray images of the arterial interiors and help in identifying the position of the block. This is called angiogram. Once the blockage is identified, a flexible guard wire is inserted into the artery vessel, followed by a balloon-tipped catheter over this wire to position itself at the site of the blockage. Rapid inflation and deflation of the small balloon pushes the vessel wall out, re-establishing the flow of blood in the artery. After the blocked vessel is reopened, the deflated balloon catheter is withdrawn from the artery. The same treatment procedure is repeated in the case of multiple blockages. Most patients may also receive a coronary stent, which is a small tube made of wire mesh designed to keep the artery open once it has been treated. A collapsed stent is placed over the deflated balloon catheter as it is inserted into position. When the balloon is inflated, the stent expands and locks itself into place. The deflated balloon and catheter are withdrawn, leaving the stent behind to hold the artery open permanently. Post-treatment, a pressure bandage is applied over the radial artery to prevent bleeding. One will need to lie down for several hours, during which signs of bleeding or chest pain will be monitored. The patient may either be discharged on the same day or after an overnight stay at the hospital.
Lifestyle changes can help prevent or slow the progression of atherosclerosis, like stop smoking, exercise most days of the week, eat healthy food, manage stress, and manage the condition of high cholesterol, high blood pressure, diabetes, or other chronic diseases.